Hi there. My name is Ashley. I'm currently a student who is studying to be a phlebotomy technician at the Quality Training Institute, where my lecturer is Miss Yvette Irving. What is phlebotomy? Well, phlebotomy can be defined as an incision into the vein for the purpose of drawing blood. The word phlebotomy also can be broken down into two meanings. Phlebo means vein and tomy means incisions. Functioning of a phlebotomist in delivering patient care. As a phlebotomist, you draw blood from patients for medical analysis, research, donation, or transfusions. You may collect blood specimen using a variety of methods like vein puncture, dermal puncture, or artery collection. Oftentimes, people are uncomfortable with having the blood drawn, and as a phlebotomist, it's your responsibility to explain the collection process and help ease the patient's nerve the best you can. Also, you will have to enter patients' billing, insurance, or specimen information on a computer. Phlebotomists follow strict precautionary safety procedure in order to limit the risk of contact with potential infectious blood, tissue, and other bodily fluids. As a phlebotomist, you need to be familiar with laws and policies related to the hazardous materials that you may work with. Prior to drawing blood, you must make sure all instruments are sterile. Record keeping and labeling are also major duties as a phlebotomist. You'll ensure that the right tests are performed on the correct blood specimen. Equipment and supply routinely used by a phlebotomist are scrubs. A phlebotomist is similar to other healthcare workers in that they are often required to dress in scrub at the workplace. Non-sterile gloves. Before each procedure, the phlebotomist will don a pair of latex gloves. Like all healthcare professionals, phlebotomists wear gloves to protect themselves and the patients. Alcohol pat. Before the insertion of the needle, the site should be cleaned with an alcohol wipe. Tourniquet. A tourniquet compresses the veins and restricts the flow of blood back to the heart. Also, this allows the phlebotomist to see the vein more clearly. Needles. Needle selection depends on the procedure and personal choice. Blood collection tubes. Collection tubes come in a rainbow of colors. Each separate color denotes a particular function and test. Labels. Blood collection tubes labels are necessary for the correct transfer of patient samples to the lab for testing and diagnosis. Gauze or bandages. At the end of the venipuncture procedure, the phlebotomist will remove the needle from the blood draw site and check for bleeding. And they will put a piece of gauze or cotton ball will be placed over the injection site and a slight bit of pressure applied to prevent any bleeding. Venipuncture site selection. Although the larger and fuller median cubital and cephalic veins of the arm are used more frequently, the basilic vein on the dorsum of the arm or the dorsal hand vein are also acceptable for venipunctures. Foot vein are a last resort because of the higher probability of complications. The major superficial veins are referred to as antecubital veins. Most times they are in an H and M-shaped pattern, but this varies from persons to persons. The H-shaped vein is found in 70% of the population and it consists of the median cubital, cephalic vein, and basilic vein. The median cubital is near the center of the antecubital area, is the preferred vein for vein punctures. This is the H-shaped vein. It's larger and close to surface. It's better anchor, more stationary, and the easiest and least painful to punctures. And it's also least likely to bruise. That's the median cubital. The next one is the cephalic vein. This in the H-shaped vein. It's located in the lateral aspects of the antecubital area. It's second choice for vein punctures, often harder to palpate than the median cubital. It's fairly well anchored, only vein that can be palpated in obese persons. The basilic vein is the last one in the H shape. It's large. This large vein is located on the medial aspect, that is the inner side of the antecubital area. It's the last choice of vein puncture and generally easy to palpate. It's, however, is not well anchored and will move easily, and you have more possibility of accident punctures. Also, punctures tends to be more painful. The M-shaped vein consists of the median vein, the median cephalic, and the median basilic. The median vein is the first choice also in the M-shaped pattern. It's well anchored, less painful, and it's not close to major nerves or arteries, and is safest to use in this M shape. The median cephalic vein is the second choice in the M shape. It's very accessible, it's located away from nerves and arteries, and it's less likely to roll and also less painful. And thirdly, we have the median basilic vein. This is also the last choice for vein punctures in M shape. It's most painful to puncture is that it's located near the medial cutaneous nerves and the brachial artery. Also, veins on the back of the hand and wrist are also acceptable for vein punctures. Needles, there are different needle gauzes with needle types and typical use of each. And the gauze 15 to 17 is the needles which is attached to collection bag. It's a special type of needle. That's the 15 to 17. The typical use is collection of donor units, autologous blood donation, and therapeutic phlebotomy. The gauze 18, which is hypodermic needle. It's used primarily as a transfer needle rather than for blood collection. Safety issues have diminished use. 20, needle gauze 20, which is the multi-sample hypodermic. It's sometimes used when large volume tubes are collected or large volume syringe are used on patients with normal size veins. The needle gauze 21, which is also multi-sample hypodermic. It's considered the standard vein puncture needle for routine vein punctures on patients with normal vein or for syringe blood culture collection. The gauze 22 needle, which is also multi-sample hypodermic, used on older children and adult patients with small veins or for syringe draws on difficult veins. And finally, needle gauze 23, which is the butterfly, and it's typically used on the veins of infants and children and or difficult hand veins of adults. Here you have the assembled syringe system, and it consists of the plunger, which is this, the graduated barrel, the cover that covers the needle, and you have on the needle you have the bevel, which is at the very point here. You have the shaft. This is a little hub and the needle, and that's it. Here we have the evacuated tube system that consists of several parts. There is the tube holder, This is also a multi-sample needle, and it consists of the bevel, which is inside of here, the shaft, the threaded hub, and the rubber sleeve over needle that is inside of the tube holder. There are different types of vacuum thinner tubes with common stopper colors, additives, found in each, also function of each, and a department that they're used by. So they're as follows. We have the light blue, the red, green, the lavender, or the purple. You can see we have the pink, the gray, the orange, royal blue, tan, and yellow. So I will start with the light blue. The additive is sodium citrate. The function is anticoagulant. It prevents blood from clotting by binding calcium. Department is hematology and coagulations. Then we have the red, which have no additives. It's allow blood to clot. And chemistry, blood bank, and serology, immunology is the department. And then we have the red, which is the clot activators, which clot activators promote blood clotting with glass or silica particles, is gel separated serum from cell. That's the function of the red with the clot activator. And the department is chemistry. Then we have the green vacuum thinner tubes, top color green, and the additives is lithium heparin, sodium heparin, ammonium heparin. And the functions is it inhibits thrombin from formation of fibrin clot. Department is chemistry. Then we have the lavender or purple. The additives EDA functions, it is anticoagulant and it binds calcium. It's from the hematology department. Then we have the pink, which is EDTA also. It prevents clotting by binding calcium and it's on the blood bank. Then we have the gray. The additive is sodium fluoride and potassium oxalate, sodium, and EDTA sodium fluoride. It's anticoagulant, it binds calcium. And it's found in the department of chemistry. Then we have the orange. The additives is thrombin. The function of additives is clot activates and STAT serum testing. It's found in the chemistry department. Royal blue. It's non-EDTA and sodium heparin. It's anticoagulant, trace metal analysis, and toxicology tests. It found in the chemistry department. And next we have tan with the additives is EDTA and it belongs to the chemistry department. And finally we have the yellow, which is SPF additives and it's from the microbiology department. Next, we're going to do the order of draw and the rationale for vein punctures. The order of draw is as follows. You have the blood culture sterile collection, which is the yellow SPS sterile media bottles. The rationale is minimize the chance of microbial contamination. Then we have the coagulation tubes, which is the light blue. The rationale is the forced additive tube in the order because all other additive tubes affects coagulation tests. And then we have the glass non-additive tubes, the red one, it prevents contamination by additives in other tubes. Then we have the plastic clot activator tube serum separator tubes, which is the SSCS, which is the red and gray rubber gold plastic. It's fail after coagulation test because silica particles activates clotting and after coagulation test carryover of silica into subsequent tubes can be overridden by anticoagulant in them. And then we have the heparin tubes with gel plasma separator tubes, PSTS, which is the green and gray rubber light blue plastic. The rationale is heparin affects coagulation tests and interferes in collection of serum specimen. It causes the least interference in tests other than coagulation tests. Then we have the heparin tubes, which is green. Heparin affects coagulation tests and interferes in collection of serum specimens. Then we have the ADTA tubes. The ADTA tubes with gel plasma preparation tubes, PPT. They are the lavender, pink, purple, pearl, and white top. These are responsible for more carryover problems than any other additives. Elevates Na and K levels. Chelates and decrease calcium and iron levels. It elevate PT and PTT results. And finally, we have the oxalate fluoride tubes, which is the gray. These sodium fluoride and potassium oxalate affect sodium and potassium level respectively. Fail after hematology tubes because oxalate damages cell membranes and causes abnormal RBC morphology. Oxalate interferes in enzymes reaction. And next we have the order of draw and the rationale for capillary puncture collection order. First we have the blood gas specimen, which is green, and it draw first to avoid introduction of room air as well as to minimize microbial infection. And then we have the blood smear, which is in don't have a tube color. These slides are used here, and it's a specimen for blood count in collecting before tubes containing other anticoagulant and additive. This is to ensure that the blood will not begin to clot before this specimen is collected. Clots will affect the accuracy of the blood count. This goes for the EDT specimen, also the lavender. Other additives is the gray. Sodium fluoride and potassium oxalate affect sodium and potassium level respectively. And then we have the serum specimen, which is the red. It's failed after coagulation test because Celestia particles activates clotting and affects coagulation tests. And finally, we have the newborn screening specimen. And newborn screening form, we have blood for newborn screening specimen should be collected separately from a different site. Being a phlebotomist, you have to have certain equipments and items on your tray always. For throughout the phlebotomy process, many supplies are necessary and should be stored within reach. These supplies include tourniquet, gauze pads, alcohol wipes, bandages, tape, syringe, safety needles, capillary tubes, microcontainers, tube tracks, etc. Keeping these items organized and kept in the same area can make this process easier for both medical personnel and patients. It's important to use a biohazard waste and sharps container for proper disposal of used items. It is highly recommended that phlebotomy supplies be kept in a tray or drawer station organizer. The steps for routine ETS when punctures. Step 1. Review and accession test requests. Step 2. Approach, identify, and prepare patient. Step 3. Verify diet restriction and latex sensitivity. Step 4. Sanitize hands. Step 5. Position patient, apply tourniquet, and ask patient to make a face. Step 6. Select vein, release tourniquet, ask patient to open face. Step 7. Clean and air dry sides. Step 8. prepare equipment and put on gloves. Step 9, reapply tourniquet on cap and inspect needle. Step 10, ask patient to remake a fist, anchor vein and insert needle. Step 11, establish blood flow, release tourniquet, ask patient to open fist. Step 12, fill, remove and mix tubes in order of draw. Step 13, place gauze, remove needle, activate safety features and apply pressure. Step 14, discard collection unit. Step 15, label tubes. Step 16, observe physical handling instructions. 17, check patient's arm and apply bandage. Step 18, dispose of used and contaminated materials. And step 19, thank patient, remove gloves and sanitize hands. And step 20, transport specimen to the lab. The procedure now for vein puncture of a hand vein using a butterfly and ETS holder. Steps 1 to 4 is the same as I mentioned before, the routine ETS vein punctures. So step 5 going to be position hand, apply tourniquet, ask patient to close the hand. Step 6 could be select vein, release tourniquet, ask patient to relax their hand. Step 7 gonna be clean and air dry site. Step 8, prepare equipment and put on gloves. Step 9, reapply tourniquet on cap and inspect needle. Step 10, anchor vein and insert needle. Step 11 going to be establish blood flow and release tourniquet. Step 12 will be fill, remove and mix tubes in order of draw. Step 13 going to be place gauze, remove needle, activate safety device and apply pressure. Step 14 is discard collection unit, and step 15 to 20 going to be step 15, label tubes. Step 16, observe special handling instructions. Step 17, check patient arms and apply bandage. Step 18, dispose of used and contaminated materials. Step 19, you thank the patient, remove gloves and sanitize hand. And finally, step 20, you transport specimen to the lab. The needle and syringe vein punctures, step 1 to 7 is same as the routine ETS vein punctures. Step 8 is going to be prepare equipment and put on gloves. Step 9 is going to be reapply tourniquet on cap and inspect needle. Step 10, go ask patient to make a fist, anchor vein and insert needle. Step 11 going to be establish blood flow, release tourniquet, ask patient to open fist. And step 12, fill syringe. 13 going to be place gauze, withdraw needle, activate safety device, apply pressure. Step 14 is going to be discard needle, fill the tubes, discard syringe, and transfer device. Step 15 to 20 could be the same as the ETS procedure. Steps to follow for capillary puncture for the finger stick. Step 1, review and accession test requests. Approach, identify and prepare patient. Step 3, verify diet restriction and latex sensitivity. Step 4, sanitize hands and put on gloves. Step 5, position the patient. Step 6, select the puncture or incision site. Step 7, warm the site if applicable. Step 8, clean and air dry the site. Step 9, prepare the equipment. Step 10, puncture the site and discard the lancet or incision device. Step 11, wipe away the first drop of blood. Step 12, fill and mix the tubes containers in order of draw. Step 13, place gauze and apply pressure. Step 14, label the specimen and observe special handling instructions. Step 15, check the site and apply bandage. Step 16, dispose of used and contaminated materials. Step 17, thank patient, remove gloves, and sanitize hands. Step 18, transport specimen to the lab. Now, on to the procedure, or should I say steps, for heel stick procedure. Step 1 is as the same as the finger stick steps from 1 to 3. Step 4, going to be sanitize hands and put on gloves. Step 5, position the patients. Step 6, select the puncture incision site. Step 7, going to warm the site if applicable. Step 8, clean and air dry the site. Step 9, prepare the equipment. Step 10, going to be puncture the site and discard the lancet or incision device. Step 11, wipe away the forced blood drop. Step 12, fill and mix tubes containers in order of draw. Step 13 is place gauze and apply pressure. Step 14 is going to be label the specimen and observe special handling and instructions. And step 15, check the site. 16, going to be dispose of used and contaminated materials. 17, thank the parent or guardian, remove gloves and sanitize hands. Step 18 is going to be transport specimen to the lab. Being a phlebotomist, there are going to be times that you're going to encounter problem sites on patients. These problem sites such as burns, scars, and tattoos, damaged veins, edema, hematoma, mastectomy, and obesity. These are just some of the problems that being a phlebotomist you can face. As a phlebotomist, you will also encounter patients who will have complications and certain conditions. These are like potassium, pain, nausea, and vomiting. There's going to be also fainting, excessive bleeding, and allergies to equipment and supplies. There could be allergies to the latex or the antiseptic or the adhesive. They are just some of the things that being a phlebotomist you need to look out for. Steps to follow if a patient starts to faint during vent punctures. Step 1 is release the tourniquet and remove and discard the needle as quickly as possible. Step 2 is apply pressure to the site where having a patient lower the head and breathe deeply. Step 3 is you're going to talk to the patient. Step 4 is physically support the patient. Step 5 is ask permission and explain what you are doing if it is necessary to loosen and tight collar or tie. Step 6 is apply a cold compress or wet washcloth to the forehead and back of the neck. Step 7, going to be have someone stay with the patient until recovery is complete. Step 8, you're going to call first aid personnel if the patient does not respond. And finally, step 9, document the incident according to facility protocol. If you want to learn more of what it is being a phlebotomist and what to expect, my references are from the Phlebotomy Essential textbook, the fifth and sixth edition, and it's by Ruth E. McCall and Katie M.